Good afternoon, everybody. My name is Becky Keatley, and I am the health educator from Cigna. And so wanting to come out and talk to you guys a little bit about being a smarter consumer. You can go ahead and progress to the next slide. So we're just going to go over a brief introduction. We're going to jump right into consumer type. Understanding and maximizing your health plan, and then we're going to wrap it up with a little bit about mycigna.com, some apps, tools, and resources. Okay, next slide, please. All right, so what kind of consumer type are you? There are 6 different consumer types up on the screen, and I think that I'm kind of a mix between discount and researcher. Okay, so I'm one of those people who, if I'm buying a washer and dryer or a new car, I'm definitely getting on Consumer Reports, I'm researching it, I'm looking at all the different reviews, I'm talking to my friends, trying to see what, kind of maybe products or brands they have. But at the end of the day, I want a good discount. I'm all about bottom line price, right? Using coupons, different kinds of discount resources. So, there are 6 different kinds of discount, of consumer types up here. And like I said, you can kind of be a little bit of a mix. So we have the loyal, the discount, the impulsive, which sometimes I'm an impulsive, like buying blues tickets yesterday afternoon. That was a little impulsive. Mobile shopper, researcher, and needs-based. Next slide, please. But many people don't really think about being a smart consumer when it comes to our health care. All right, a lot of times we go to the doctor tells us to go have maybe a lab done, a certain procedure done. We say okay and we get it done, right? We don't look at it, we don't research it, we don't think about it, we don't think about discounts. Can you guys give me a show of hands in here of maybe who's on the high deductible HSA plan? A couple of you. So you guys have more of this probably to think about when you use your benefit plan versus somebody who has a copay plan. Next slide, please. Next slide. So for you that raised your hand for the HSA, we'll just briefly go over why it's so great. It is a triple tax advantage, so that means the money that's coming out of your paycheck going into the HSA or the money that you're putting in is pre-tax dollars. The money is pre-tax dollars when it comes to investing. If you're investing anything with it, it has to get to a certain amount before investing is an option. And then, of course, when you're using it for your qualified medical expenses, there's the tax advantage there as well. So triple tax advantage. You have to be enrolled in a high deductible health plan to be qualified. You have to use those expenses or those dollars for medical things or dental or vision, all right? Those are what are qualified expenses. And then this fund is a little bit different than maybe what you guys have had in the past, maybe like say an FSA, because this is not one of those use it or lose it funds. These things continue to go with you. It's more like a savings account. So even if you aren't at SAK, that account goes with you if you have dollars that are in your account. And then, of course, like I already said, that you could do investment options once it gets to a specific amount. Okay, next slide, please. So the first thing that I always like to talk about, being that smarter consumer, it's always going to roll down to trying to stay in network. Okay, this is going to be whether you're on the HSA kind of a plan or if you're on a copay plan. This is going to be where your biggest bang for your buck will be. Okay, so if you hit it one more time, how do you know that you're staying in network? Just a show of hands, how many people have the access to the portal that have registered for mycigna.com? Pretty much everybody, so that's great. So mycigna.com, there's also a mobile app, which I think is amazing. Pretty much everything that you can do on the portal, you can do on the app, but that's where you're going to find those in-network doctors. All right, so one of those things that we always like to point out during open enrollment meetings and our seminars is if you're trying to contact a doctor, pick up the phone and you're talking to them, don't say, hey, do you take Cigna? Everybody takes us. You need to ask, just like it says up here, are you contracted in the network with Cigna? All right, and on the Open Access Plus plan, which is what you guys would have. And then always know, too, if you're having problems locating your doctor on mycigna.com, or if they have questioned if they are in network with us, you can always call our 24/7 customer service number as well, okay? Just the number on the back of your card. Next. Okay, so I'm kind of a statistic geek, I guess, is the nicest way of saying it. So when I look at all this is from a health educator standpoint, this really sticks out to me. So at least 80% of all heart disease, stroke, and type 2 diabetes, and up to 40% of cancer could be prevented. That's like mind-blowing to me, right? So what kinds of things will help us prevent these awful chronic conditions? So it all starts with you. Exercising regularly, eating nutritiously, getting enough sleep, reducing our alcohol and tobacco use, and of course being 100% compliant to those medications that the doctor is requesting for us to take, okay? So next slide, please. This goes into preventive care. It is so important to try to ward off some of these awful diseases and chronic conditions that are out there by going and getting your preventive visits, all right? So one of the things in your benefits that's 100% free is going to be your Well Woman and your Well Man annual visits. And that's going to help you be a smarter consumer because you're going to be able to be more mindful of your own health and be able to control it by having that rapport with a general practitioner, okay? Because a lot of times if you don't have a rapport with a general practitioner, where do you think you go when you're sick? That's exactly right. Straight to the emergency room. And there is nothing smart about having to go to the emergency room when it's not a true emergency, because that is a lot of money out of your pocket, especially for you high deductible HSA people. You got to meet that deductible before the plan kicks in, so all that money is coming right out of your pocket. But yet for your copays, that's going to be the highest copay structure that you're probably going to have too, is going to be that ER copay. All right, so preventive care. Immunizations, your annual wellness checkup. So us women here in the room, we get kind of a 2-for-1. We can go and have a well woman at our OBGYN, but we can also have a well visit at our general practitioner. So we get 2. So that's going to include your mammogram, if it's a true preventive one, your pap smear, your blood work, and your regular annual checkup. And then for the men in the room, you get your well man visit as well. All right? Colonoscopies also fall into this, but just know mammograms and colonoscopies sometimes can turn diagnostic. So I always like to talk about that during our meetings too, because you go in, let's say, especially on a colonoscopy, they put you under, you're doing the procedure, they find, let's say, 5 polyps. They're not going to say, Mrs. Smith, guess what? You have 5 polyps. Come back next week and we'll take those out. They're going to take it out right then and there, so that, again, it's a preventive measure of not having cancer maybe down the road, but all of a sudden that turns diagnostic because those are pre-cancerous cells that are in your colon, okay? So since they're doing a procedure and taking them out, that turns diagnostic because they're going to send those off. They're going to see, what biopsy and all that good stuff down the road, all right? Same thing with a mammogram. We go in for our mammograms. If they find something, all of a sudden that's going to be diagnostic, because now we're going to see what stage are we at, is it benign, is it malignant, what's going on, okay? So I always like to point that out, because sometimes that's a wide-eye, opening kind of an event. You go in, you think it's a preventive measure, and then all of a sudden you're getting a bill from the doctor, okay? So again, this is why being the smarter consumer and using some of our resources to make sure that we find the cheapest colonoscopies and mammograms out there. We'll talk about that in just a minute, okay? Age and gender specific screening. So again, those colonoscopies and cervical cancer screenings, those mammograms. But then also when we're there for our well man and our well woman visit, they're going to have us do the lab work, all right? Quest and LabCorp will always be the places that will be cheapest, especially for those HSA people that are in the room, because Quest and LabCorp give us the biggest discount so that you guys get the biggest discount. I always use myself as an example. So my daughter's having some really major issues going on right now, and we had to go see an endocrinologist down at Children's Hospital last week on Tuesday. And he gave us 11 more tests that he wanted to run. Of course, the ones that the pediatrician's office had already ran weren't good enough, right? He wants to do his own test. So I asked him, I said, can we do that at Quest versus here? And he was like, yeah, I can give you a script for that. So all of my tests, they're coming in, they're trickling in about, $100 here, $100 here, but I know that it's still a lot cheaper than if Children's Hospital would have processed those, right? The next one was he wanted her to have an arm and a hand x-ray done. And I know that Metro Imaging is a lot cheaper than Children's Hospital, because she had a couple of years ago a heel x-ray, and it was like $700 down there, and it was $23 at Metro Imaging. And I almost got sick because I had paid the $700. So I asked him, I said, Dr. Stone, can we go to Metro Imaging, because I know it's going to be cheaper for this x-ray? And he said, well, I've never done that before, but I'm open to it. I'll have my assistant come in and give you a script just like I did for Quest. So that's what we did. We made an appointment, went in and got the x-ray. It was $22.10 at Metro Imaging. So being that smarter consumer and advocating for yourself, because I have 4 choices of high deductible plans as a Cigna employee. That's all we have. So all that money, the people that are raising your hand for the HSA, I have the same plan as you guys. So all that money is coming out of my pocket. So I want to be that smarter consumer. So when it comes to blood work, when they're saying, hey, go downstairs and have that blood work drawn for the well woman, well man, even though it's a preventive, it's still going to be cheaper back to the plan if you stayed with Quest or LabCorp. And for the HSA people, if you guys have diagnostic labs, let's say we have a thyroid condition and we have to test our levels ever so often to get our medication, Quest and LabCorp. Okay, next slide. All right, knowing where to go. If you click it one more time. So the cheapest one that you're going to have is going to be telehealth. Has anybody in the room used telehealth? One? Okay, so telehealth, how it's going to work. For the HSA people that are in the room, I feel like I'm falling off here. It's going to be either $45 for MD Live, or it's going to be $49 for Amwell, because we partner with 2 different vendors to provide you guys this service. For you guys with the copay plan, it normally follows the copay structure of your general practitioner. Okay, so whatever your general practitioner copay would be, that's what telehealth would be. So how telehealth works, you guys can get on mycigna.com. It will link you directly to telehealth services, and you can pick either vendor. The only difference between the 2 vendors, Amwell, you have to have like the virtual component to be able to have them prescribe in the state of Missouri a prescription. MD Live, you don't have to. So the virtual component would be on a smartphone or a tablet or a laptop that would have like the little video camera. If you guys are still like my parents and they only have a home phone, then that virtual component wouldn't work, okay? So I've always used MD Live. We rolled out with MD Live about 6 years ago, and we were the pilot of the program just to see if it was going to work and how we liked it as an employee, and I absolutely love it. I've used it for things that, like about 3 years ago, my daughter shared pink eye with me, so I used telehealth. I get reoccurring bladder infections. I use it for that. The flu epidemic would have been a great example of what kind of service to use it for, but it's for those kinds of things that you already kind of know what's going on. You have a sinus infection, things like that. It might be a Friday afternoon, you can't get to your general practitioner, or maybe you're away on vacation. Telehealth is going to be a great resource, all right? So you can do it, like I said, virtually, where it's almost like bringing the doctor into the room where, you've got your cell phone up here and you can see him and he can see you. So it's like a Skype or a FaceTime. It's pretty cool. I normally just step out in the hallway from my cubicle and I have it on the phone and I just talk to him like an after hours kind of a doctor visit. If it warrants a prescription, you can have it sent wherever you want. They'll send it and you can pick it up. So it's really convenient. This is going to be a great thing if you guys have kiddos away at college. They still may be doctor here in St. Louis, instead of them going to that emergency room in the middle of the night when they get sick, telehealth would be an awesome thing if they're still on your plan. Okay?
Should basically a hotline have or an extra hotline that you have to call?
Yep. So when you make your profile on either Amwell or MD Live, you can put on like all the health history information. So like, again, I use myself as an example. I get migraine headaches and I'm allergic to amoxicillin. So I have that listed. So before the doctor ever talks to me, he can pull up my health history and he can see, oh yeah, Becky has, maybe 5 different visits about the bladder infection. This is the kind of medicine that normally I take. I can't have amoxicillin and I have migraines. So he has a full picture of whatever I want to share with him, right? And so then, like I said, you can do it virtually. So let's maybe have a rash on our arm. Maybe it's poison ivy, maybe it's not. That's what we need to figure out. You can actually, from the virtual, like show him the poison ivy. Hey, doc, is this poison ivy? The pink eye. Hey, is this pink eye? That kind of a thing. All right?
Can you upload stuff from your medicine and stuff?
You would have to type it in. Yeah. Good question. Any other questions about telehealth? All right, if you push it again, we'll go to the next one, which is convenience care. Convenience care is awesome too. So telehealth, I already said, it's about $45 or $49 on that HSA plan. It also follows the copay. Convenience care on the HSA is about $80. Okay?
Everything. I'm so sorry.
No.
Oh, or that's okay. That's your copay?
Yeah, unless you have a copay plan, the copay plan would be whatever your general practitioner would be for the telehealth. Convenience care. So these are the ones that are going to be more in like a Walgreens or a CVS. Now, a lot of the ones at Walgreens, you can actually make an appointment ahead of time. You don't have to just walk in. And they can do a lot of things. They can give immunizations like flu shots. They can test you for the flu. They can test for strep. They can test for bladder infections, sinus infections, all that good stuff. So convenience care is going to be a great option when you can't get into your doctor as well, okay? And they will also send the report to your general practitioner if you would like. That is a question that they ask you. Next one, of course, is your doctor's office. Nothing trumps the doctor's office, right? Because like I said, that rapport with your primary physician is going to be so instrumental when it comes to battling different kinds of chronic conditions and everything. Next one will be urgent care. So I always tell my groups, before the accident happens, call the urgent care. You can make sure that they're in network with us on mycigna.com, but call them because not all urgent cares are the same. And the last thing that you want to do is to go into that urgent care and them to tell you, oh, guess what? Mrs. Smith, we can't get you better. That's more of an emergency room thing because they're going to bill you and then the emergency room's going to bill you. And we definitely don't want 2 bills for the same condition, right? So some urgent cares, they can do stitches. They can set broken bones. Some of them have CT scans. They're really becoming very advanced in the urgent care world. You need to make sure too, not all of them have the same hours. So you don't want to get there and they're closed and you still have to go to the emergency room, right? So definitely kind of figure out maybe the closest urgent cares are to here and to home and figure out what their capabilities are. And then the next one, of course, which will be the most expensive, will be the ER, okay? Just to walk into the ER, we normally say is about $1,700 on that high deductible plan. That's before they even hardly touch you. All right, but for you copay people in the room, you have a copay. Yep. Yep, for your urgent care. And then for the urgent care for the high deductible people, the walk-in's about $150. Okay, next slide, please. So we already talked about this with Quest and LabCorp, but again, I like the statistics. $10.46 are the average for Quest or LabCorp compared to $62 at the hospital. So this is why I took my daughter to Quest the other day because I knew, that's a huge increase, right? And when it's all coming out of my pocket, I don't want to pay this when I could be paying that. All right? Yes, ma'am.
What if they send it to Quest or Lab
and you can,
from the doctor's
Yep, and you can do that too. So that's going to be the question. Who processes your labs? If it's ABC, XYZ, then you're going to get the higher charge, whether that's going to be probably the average lab cost, because that's going to be an in-network lab too, or it could be a hospital one, like if I had Children's Hospital doing it the other day. But if they actually have Quest or LabCorp that can come and pick it up, because you can see sometimes at pediatrician's office and general practitioner office, they'll have like those metal boxes hanging on the door, and that means LabCorp or Quest are coming in, they'll pick them up. That's fine. They can draw it, but somebody else has to process it, which is going to be LabCorp or Quest.
So it's still the,
You'll still get the discounted rate. Yep. Yep.
just like we would go in.
Yep. So the pediatrician did my daughter's first labs, and I got like nickels and dimes for them to draw it. It was like $5 a test for my pediatrician to touch my daughter to draw all these different tests. And then they sent it to Quest, and then Quest, you know, $75 or something, I think it was. Whereas, again, I know the hospital would have been a lot more. Okay. Next slide. All right. So these are going to be expensive. Probably prescriptions and kind of outpatient procedures are going to be the ones that are going to hit your pocketbook the most, whether that's a copay plan or the high deductible. So how can we kind of look and see how that's going to you know, benefit us by using these kinds of tools and resources that we have available? So the colonoscopy, endoscopies, and arthroscopies, okay? All of these different outpatient surgery centers that are in network, that are freestanding, are going to be a lot cheaper than, of course, the average hospital cost. So if you get onto mycigna.com, you can look up the price of stuff. Has anybody used a cost estimator tool? You haven't gotten it to work? The only thing will be, and I have to preface this, if the large hospitals downtown don't provide us with the transparency of the pricing, we can't give it to you. So the large hospitals downtown, not naming any names, but my daughter was at one the other day, they know that they're expensive, and they know that they're a lot more expensive than some of the other hospitals, so they don't provide that because they want you to still go there, which makes sense, right?
All right. And why can't you, so I tried to use it for, like my daughter has ADHD medicine, so, and it won't because it's
A controlled stuff, yeah.
controlled. So why won't it at least just give you process? That stuff too is cheaper if you're on a high deductible.
It should give you a cost estimator for the 30-day, not the 90-day, because don't you have to have it every 30 days? And we'll look at the cost estimator tool for the prescriptions in just a second, because they have to be very specific, because it asks you like the milligram strength, how many times a day, and then, yeah. But it should provide you with that, I would think. But we can double check, and it might be because it's a controlled substance that it won't provide that information. So that's a good question. We'll look into that though. So again, the cost estimator tool, when you go onto mycigna.com, if the information is shared with us, we can share it with you. You toggle at the top to find the cost estimator tool, and then you can, let's say we're having a colonoscopy. We'll type in colonoscopy. I live in 63129 zip code, and it'll ask me how many miles I'm willing to drive for that procedure. And it will pull up every person within that you know, area that will do that procedure. So then you could say, okay, doc, I found this colonoscopy for this price, and you guys are wanting this price. Can I go there? And then that's the conversation that you have to have between yourself and your physician. If for some reason your physician really wants you to go here and he gives some good reason, then, you know, that's something, again, that you guys have to figure out for yourself and your family. Yes, ma'am.
And then, as example for that, when that happens, you can say, I've gone through this. No, I can go here, and it's only going to cost me a few hundred here, a couple thousand. They're like, oh no, but we don't trust theirs. We want you to do it here. Like, well then fine, but I'm not paying for it. And in the end, they actually did the test there at their facility, their hospital, and they did not charge. I even checked to make sure they didn't process the claim.
That's awesome.
So you have the right.
Yeah, and that's what it comes down to, is that we can be, in this consumer-driven healthcare world, we can be our own advocate, and that we can, just like you said, kind of stand our ground and say, this is what we do. But a lot of people don't know that. So like I said in the very first couple of slides, whatever the doctor says, we're like, okay, because we don't know any different, right? So next slide. So the next one's going to be the radiology. So I gave the example of the arm x-ray. So that's just an x-ray, let alone a CT scan or an MRI. So if we go to, again, like a Metro Imaging, a CT scan is going to be about $500 versus $1,400 at a hospital, okay? MRI about $800 versus $1,700 at a hospital. And my husband had the same exact thing that you're talking about. He needed an MRI for his back. Some of the doctors from downtown said, oh, well, their MRIs at Metro Imaging aren't as clear as ours. Okay, so if you go and have that procedure and you pay for that procedure, then we're probably going to have to send you to ours and have you redo it because we're not going to be able to read it. Really? So in the end, my husband had it done at the big doctors downtown, but it's your decision as to what you want to do. All right? I've not ever had anybody tell me that the Metro Imaging and the freestanding places give less quality. So next one. So this is what it looks like. So this looks a little bit different than what we've updated our mycigna.com recently. So it's going to look more like find the providers and the costs. It's going to be one of the first two tabs instead of this, but it's going to work the same exact way. Once you're in there, you can do a medical estimator or you can do it by looking up your prescriptions. And on the app, it looks just like this, where you're looking for your providers and your cost. So you can do that cost estimator tool right in the office. So let's say the doc says, hey, take this prescription. You can get out your cell phone, you can type in that prescription, and you can get a better idea of what it's going to be like on your plan before you ever leave. So if that doc's trying to give you, a preferred brand or a non-preferred brand versus a generic, you can get an idea of like, hey, I'm not paying that. Is there something else that you can prescribe me? It's going to be just as good for my condition and better on my wallet. Okay? Next slide. So prescriptions, again, I think that's probably my biggest wow moment when I went years ago, about 6 years ago, to my first HSA plan. When you're going in and you've been on a copay plan your whole life, you go to Walgreens or CVS or Walmart, you give the copay, and you walk out with your medicines, right? But just like for medical, when you pay everything up until that deductible, it's the same way on your prescriptions. So, you're going in and it could have been maybe a $20 copay, and now all of a sudden you're paying $150 for this script. All right? So one of the things that's going to benefit you guys to be that smarter consumer is to look at your drug list. They're on mycigna.com, and you can get an idea of where prescriptions fall. You can even print it out and take it to your doctor. So when we are making our well woman and our well man physicals, bring the formulary with you and say, here, doc, this is my actual formulary. This is what you can prescribe me for my condition. And ultimately, ask about generics. That's always going to be your, most cost-efficient medication. All right? And then again, the drug comparison tool. You can pull it up right there in the office. And then, of course, you can manage all of your claims always, whether it's medical or pharmacy claims, on mycigna.com. And then you can also think about even switching those 90-day medications to our home delivery if you guys want to, for convenience factor, but also sometimes it's cheaper depending upon the plan that you're on. Next slide. So this goes back to your question about the medication and how the drug comparison tool works. So this is what I was saying. You have to have all the information. So for the form, it says that this one's like a tablet. It's a 20 milligram. You take it once per day for 30 days. All right? It's going to pull up, and it usually pulls up pharmacy. A lot of times it's two pharmacies, but it'll compare your pharmacy based upon this one says Phoenix, Arizona, and then what is it? Prenaville is the drug that's been selected, but it should pull up the selected pharmacy in Phoenix, Arizona, and it normally compares it to the home delivery so that you can see the comparison between the retail and the home delivery also. And then again, you can do the same thing on the app. Okay? All right. Next slide. So this one's just a follow-up. It's going to be our last slide, just to kind of get an idea of what are some behaviors or changes that you can adopt. So my number one takeaway always for my groups, schedule that annual visit with your doctor. If you don't have a doctor, get on mycigna.com and locate the in-network physician. But ultimately, use the tools and resources that we talked about, but get that annual physical in. It's 100% free, and that's going to be one of the best decisions that you can make for your health. Okay? Any questions? Nope. All right.
What about in-network providers? When you follow up procedure, you get an in-network provider. It was on the website. You also call to make sure the website's not always correct. So you call, they say yes, but then they bring somebody else in to want something with that, or to send it off to a third party, and they're not in-network.
Yep.
Of course, you as a customer,
You don't know that. Yeah, and a lot of times that will happen with the lab work. Sometimes surgeries, it'll be the anesthesiologist. Anytime that you guys get bills that you have questions about that you don't think are right, hit up Angie. Angie will get a hold of us, and we can research it. I myself can't, but our claims people and our service person, they can go in and they can research all of that and be your advocate, because if something's not processed right, we're going to reach back out to that provider and make them reprocess it correctly before they resend it to us so that we can then process the claim. Okay, that's a great question. All right, so again, being your own advocate, just because the bill says this doesn't mean that you have to pay it.
And everybody has the right to ask for a detailed bill. Get that $12,000 bill in the mail or whatever it
Yep.
is that has no detail whatsoever. Call them and say, I want a detailed bill. They have to.
That's correct.
you'd be surprised how many mistakes they do.
Oh, absolutely.
And claims that they submit that aren't even accurate. You know? And I mean, even if you met your annual maximum out of pocket, I always look at it as though every dollar saved that it was billed that shouldn't have been. I might not be paying that anymore, but I am in the long run, because that means the premiums go up drastically, which means in the long run our premiums go up. So saving not just in the beginning, because it's out of your pocket, but
That's exactly right. That's very, very true. And always, before you pay a bill to a provider, make sure that you've looked at our explanation of benefit to make sure that it matches. Because if it doesn't match, then that's a huge red flag right there. Because that means that they're billing for something that we haven't seen, or that, you know, if the bills and the EOBs don't match, it's so hard once you guys pay the provider to get a reimbursement back. So again, if that red flag happens, reach out to Angie so that she can reach out to us, and we'll research that on your behalf, because nobody wants to go through that and pay more money than what they should. Yes, ma'am.
necessary for those kind of things. So how would you fix that?
You can appeal different processes that are in place. Let's say if you're supposed to get XYZ and we've declined it for some reason, you can appeal that, and that we go through a different kind of an appeal process. But ultimately, why those kinds of policies or procedures are in place, it's all about cost. So I will say, like an MRI will be a good example. So many people back in the 80s and 90s, they were getting tons and tons of MRIs. You know, and that, again, we just talked about how expensive those MRIs are, right? I'm a physical therapist by trade, so I see a lot, well, I did see a lot of these kind of people that would have different kinds of conditions that would be coming in to get physical therapy. So maybe the MRI wasn't warranted because it wasn't a true condition that needed a surgery. Physical therapy or maybe a different anti-inflammatory medication could help that. So that MRI being the very first thing that people would go to sometimes just isn't warranted. So that's why these kinds of policies and procedures are put into place. Different kinds of things on medications sometimes have different policies and procedures. You have to go through sometimes what's called step therapy before you can take a specific medication. Let's say you want a medication that's $5,000. That's expensive, right? It's expensive for you. That's expensive for the plan. So there are different steps put into place. Let's say you need to try the generic form, if there's a generic form, or you need to try this form. And then once the doctor says, oh, Mrs. Smith tried the generic, it didn't work. She tried the other one that was in the classification, it didn't work. So then the doctor just needs to show medical necessity as to why the $5,000 drug would be the best one. But that's what happens for the policies and procedures are in place. It's just to help with cost savings. It's not that we're trying to to be mean and say that you don't need it, but we're wanting you to try some lower cost things first before.
But that doctor already says you need this. Then you have the doctor says,
Right. Right. So then they will get the pre-auth, but remember who's billing that? It's the doctor's office. So just like the example of my husband for the MRI, and they didn't want us to go to Metro Imaging, it's because they're wanting my husband to have that, and they're billing it.
But on medications, though, it's totally different.
It's not totally different. Some higher price medications are the same exact way. The doctor is prescribing it, and they're prescribing it for a reason.
Right, and I understand that. Like, for example, like this is back kind of to my daughter.
Sure.
She's 9.
Sure.
And if, she kind of had to be a guinea pig for a little while, because even though he had already said, look, this one's not going to work for her because I think I feel this way.
Right.
And even he had to write, like he wrote
and that's
a
how,
letter.
yep.
And unfortunately, like it just took us a year now
To get it on.
approved.
Yeah.
Literally, it was
A nightmare. I
so aggravated.
completely,
My 9-year-old daughter be a guinea pig.
yeah, and I completely understand, but ultimately it's because of these high prices. Sometimes they're specialty medications. Not all medications are in our formulary because, there's millions and millions of prescriptions out there, right? So how Cigna builds the formulary is we try to take out some of those higher cost drugs so that people aren't always going to those higher cost drugs, because it's so expensive for the plans, and it's always expensive for our members, and we want them to be able to have the medications, but they just have to go through that step therapy. Like your daughter, unfortunately they had to try that. My niece is the same way. So I completely understand. Every year she has to have authorization before, so it's frustrating, but know that ultimately it's there to be a cost-saving measure and to make sure that what you guys are taking is going to be the best for you. Sometimes it's just, those doctors unfortunately have to jump through some hoops when it comes to proving the medical necessity, and that's what you're talking about. And like I said, my niece, unfortunately, she's on like Humira, which is it's like one infusion's like $5,000, and so every single year she has to have that medication approved by their insurance agency too. And the very first time, she has a very rare condition. Only like 60 children in the world have this condition. So the condition doesn't have like an actual clinical reason why you should be taking this med, because the med's for rheumatoid arthritis. So then they had to jump through even more hoops to prove that this was going to be the right one. But again, it's because those medications are so expensive, and for her, she was only like, 4 or 5 when she started it. There's no research as to a small child taking some of these major meds. So, there's a major thing there too. So again, there are these policies and procedures in place, and I'm sorry that, it is frustrating. And like I said, my family has experienced them as well. So I totally get it. But just know that those procedures are in place to make sure that, again, that you guys are getting the right treatments that you need that are medically necessary, I can't talk, at the best price possible for your family.
And I also actually, so I ended up calling the drug manufacturer about like the coupons, like a discount card and stuff, and found out that they have like an assistance program. So
Yep.
is there something that you guys like, you know about drugs or programs or anything?
Yeah, so there are rebates out there. So let's say, and not just about like these high pricey medications, but Walmart has like a $4 formulary. So sometimes, you know, they don't even run that through insurance. So some medications like thyroid, blood pressure, those kind of things. Yeah, you can go to Walmart and you can find those kinds of, you know, medications. Sometimes people, like one of my colleagues actually years ago that I worked with, her husband lost his job and she was on a medication because, again, us Cigna employees, we have those high deductible plans. She was paying like $80 a month for, I believe it was a hypertension medication. And so she printed off that $4 list from Walmart and she took it into her doctor. And she said, what on here is going to work? And they said, well, we'll put you on 2 medications versus just the one. And so she paid $8 versus $80, you know? So that's a way of being that smarter consumer too. Walgreens has a program that's like I think it's $25 a year, and then you become like a preferred. The only reason why I know this is because my dog was on medicine. My dog. So Gracie, my little dog, she had her own little thing at Walgreens every year that I had to renew. But, you know, it discounts the medications that you need. There's also, you guys might have seen recently, there's a commercial out right now for GoodRx. We don't promote that because a lot of times you don't run it through insurance, so that doesn't help with your deductible. So it's not something that Cigna really promotes, but it definitely works. So GoodRx is an app. You can put in your prescription and it's like a coupon. And I do believe that you have to use that coupon that day, that you have it kind of like up on your phone.
Yeah, you can just do it on your phone.
Yep.
You're there,
Yep.
And then you can just show them.
Yep.
And they'll
Tell you the closest pharmacy.
And that's right.
And the price of like food.
Right. So Walmart might be cheaper than Walgreens, or Walgreens down the road might be cheaper, so it'll tell you where to go for that script. I know my father-in-law, he passed away in January of leukemia, but one of the last trials that we tried, we were hoping that it would work, and it was like a $13,000 medication. And after the trial, if it was still working, you know, that would have been his responsibility. Nobody has $13,000, you know, a month for a medication. So I just piddled around with that, and it did.
So you can just get on their app,
Yep.
save your medication, and
Yep.
wherever you're at, like, you have to be out of the office and you forgot it or something.
That's exactly right. So GoodRx is an option. Like for my father-in-law, it was going to take $10,000 off that medication. It brought it down to $3,000, which $3,000 is still astronomical. Nobody could really afford that either. But I guess if it's a difference between life and death, right, we're going to find it some way. But it definitely worked in that example, and that's the only example I have. But yeah, so there are other options out there when it comes to medications and different ways of saving. So that's a great question. Any other questions? Awesome. Well, thank you guys.